Hello, this is Denise Dias from the K-State Research and Extension Johnson County office. Today's topic, Medicare Basics. Medicare is a federal health insurance program which began back in 1965. It's available to three different groups: those people that are 65 and older, people with disabilities, and people with end-stage renal disease. Medicare is open to people regardless of their income and is not based on financial need. Medicare is not free for people called beneficiaries. It was designed so that the beneficiaries could share the total cost of healthcare with the federal government. They do that through premiums, deductibles, co-insurance charges, and of course payment for non-covered or excluded services and items. Medicare will only cover services that they deem to be medically necessary. So many of the services and items that people are looking for are not covered, and the list is here. You can see things like coverage of care outside of the U.S., or routine dental and eye care, or hearing aids. Those types of things are not covered by Medicare. To sign up for Medicare, you need to do so through the Social Security office. If you have limited funds and are considered low income, you may qualify for a program called Extra Help that would help you reduce your medical costs on premiums and prescription drugs. So apply for that at the same time. You can enroll in Medicare three different ways. You can do it in person at the Lenexa Social Security office. You could also do it through a phone call, and the phone number is there, but the fastest and easiest way to do it is at ssa.gov. Your initial enrollment period to go onto Medicare are the 3 months before you turn 65, your birthday month, and the 3 months following your birthday month. That's when most people that retire at age 65 take Medicare. If you plan to work beyond age 65, then you have other things you need to consider. Now I'd like to switch gears just a little bit and break down the 4 parts of Medicare. We're going to talk about Part A, Part B, Part C, and Part D in the next few slides. Medicare Part A has 4 main benefits: inpatient hospital care, skilled nursing facility care, home health care, and hospice care. Medicare Part B covers things such as your physician care, outpatient hospital treatment and surgery, home health care, durable medical equipment and supplies, ambulance services, and prevention and screening services. Medicare Advantage, also known as Part C, is offered by private insurance companies that focus on prevention, and also they limit the use of some of their services. They combine A, B, and D into one nice little package, kind of like an HMO or PPO, which you may have used when you were employed. Medicare Part D is the Medicare prescription drug program. You choose a Medicare plan based on the coverage it offers, the cost of your drugs and premiums, and convenience of picking up those prescriptions. You can review that every year in the fall and make sure that the plan you're in is saving you the most money, and I highly recommend that you do that. Medigap, or supplement plans, are sold by private companies that help fill in the gaps of Medicare coverage. Typically, Medicare covers roughly about 80% of your healthcare costs. So you need a supplement plan or potentially an Advantage plan to help fill in the gaps of what's not covered by Medicare. So all this boils down to 2 options. The first one is to go with the Medicare Advantage plan, where everything's bundled together. The other option is to go with original Medicare and a Medigap plan. And that way you have everything covered. People often choose option 1 if they're very healthy and don't need a lot of medical care. Option 2 is often chosen for people that want to travel or have chronic health conditions. Everyone's healthcare needs are different, If you have more questions, please send me an email at the address below. Denise has been trained, certified, and background checked by the Kansas Department of Aging and Disability Services to be a SHIC counselor. Johnson County Extension and Denise do not receive any compensation for this service. Our goal is to provide research-based information so that you can make an informed decision regarding your healthcare needs. My contact information is below. Thank you.